impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
Hi, it's Dr. Kenny Levine again with Health Talk, seen on WEYW19.com and UVerse Channel 19. I'm here with Dr. Eli Friedman, prosthodontist to the stars. Eli, before I forget, would you please let our viewers know how they can find you?
Well, nowadays, the easiest way to find us is online. FriedmanDentalGroup.com is the website. That's FriedmanDentalGroup.com. Or you can call us at the office. 954-752-5560 is the phone number. And one of our staff members can direct you to any of one of our 3 locations in the South Florida area.
Tell viewers again where the 3 locations
Yeah, we have our practices are, one is in Palm Beach, Florida, on Palm Beach Island. The other practice is in Coral Springs, Florida, and our 3rd location is in Plantation, Florida.
Okay, and you're available at any of those locations?
I'm personally available at any of those locations, depending on what day of the week we're trying to get an appointment.
So we talked a little bit about the gray line around old porcelain to metal crowns.
Yes.
One of the things that I try to emphasize to my patients and my doctors is that it's important to have a thick layer of gum tissue to protect the crown, whether it be on a tooth or a dental implant. And as a periodontist, a lot of my work is aimed at creating that barrier of gum tissue. Let's talk about a patient who's missing 1 or a couple of teeth in an area of their mouth, and they need either dental implants or a fixed bridge. Are there tooth-colored restorations that can be used today for a fixed bridge without metal support?
Absolutely. And most of those times, most dentists will elect for a zirconia-based restoration because their zirconia is the substructure, which is the internal part of the bridge, and that gives the bridge strength. So we're using it in anterior or front teeth, and we're using it in back teeth for bridges. We're using it for longer span bridges also. But when you get to a certain point, dentists would kind of elect at that point to either complement the case with implants or choose to go to a metal-based restoration. That's where implants become vital in the treatment planning process.
Sure. The other day I took care of a guy who was only 6'5" and weighed 325 pounds. I told him he can't have an implant bridge. He needs 1 implant per tooth, which we're going to splint together.
Right.
But a little lady who weighs 95 pounds, there's less stress. How do you feel about that?
I feel very similar to the way you feel. I mean, it's a case-by-case basis, certainly, and part of that's going to be dictated by the person and your judgment of the specific case. A lot of times we can get away with fewer number of implants, and I always tell patients we don't want to overdo it with a case, but we certainly don't want to underdo it, because when you're going into surgery, because it is surgery at the end of the day, and you're doing surgery, you don't want to do that surgery again. So we want to minimize failures. So oftentimes it's not necessarily a bad thing to have more support than necessary, because if you under-engineer the case, we call it engineering. On my end, it's engineering, because I'm looking at things from the top down. We don't want to underdo it. We want to have just enough support for the patient.
You know, in the past, patients were told by dentists, gee, you don't have any bone. Your ridge is too narrow, it's resorbed, your sinuses are too big. At my end of our profession, we can rebuild bone. We can make ridges wider, we can make it taller, we can raise the sinus so that almost any patient who's medically healthy can become a candidate for implant restorations.
Yes.
And we do the implant surgery, and then they get to you to put on beautiful caps, crowns, bridges, or removable prostheses. So it's a great synergy I have. And when we work together, I'll say to the patient that I respect Dr. Friedman enough that he looks at it with a different pair of eyes. He can call me up and say, you know, I have another idea. Let's consider this for the patient. Right. Because every patient is different. It's the beauty of what we do.
And that goes the same way with you. And working with a surgeon who has the knowledge and appreciates the restorative perspective, you know, the dentists have to complement each other. You know, I certainly have a great respect for what you do, and I certainly value your judgment when it comes to the surgical side. And that's why when you're looking at things from both perspectives, you have that ability to use both specialties and expertise to complement one another, so you end up, the patient benefits with the best result.
Well, I've been trained by lots of prosthodontists,
right,
and I know that implant dentistry is a prosthetic discipline with a surgical component.
And I train with lots of periodontists, so you know that's how I kind of, I see my forte is having the appreciation on the surgical level, not necessarily doing it myself, but appreciating the challenges on that end.
Well, this has been great. I look forward to seeing you again. And
Thank you.
Thank you for taking care of all the patients.
Thanks for having me, Kenny.
Okay. It's Dr. Kenny Levine with Health Talk. We'll see you next week. Thank you.
Smile, though your heart is aching.